Richardson. How are you doing today?
Oh, I'm doing just fine, honey. How are you?
Oh, I'm very well, thank you. I'm looking at your medical history and I see you have diabetes. Is that correct?
Yes, ma'am, I sure do.
Do you do anything to regulate it or eat any special foods or have a special diet?
Well, I'm insulin dependent,
Okay.
so that helps. I take insulin, and I try to watch what I eat.
Because I see you have some chocolate over there.
Yeah, I like my chocolate. If my sugar feels like it's getting a little bit low, I'll just pop me out one of my little Reese cups or whatever I'm carrying in my pocketbook and eat it, and it makes me feel a whole lot better.
Well, when do you usually eat that?
Well, most of the time, I like to eat my chocolate before I go to bed. I like to have a candy bar, like a Snickers or a Butterfinger.
So, when you eat your candy bar, do you then brush your teeth or do you just go straight to bed?
Oh, absolutely. I brush my teeth before I go to bed.
You do brush your teeth for that's
Yeah, because I don't have many teeth left in here. I've lost a lot of them, so I've been trying to take care of my teeth.
So how many times a day do you think you brush your teeth?
Oh, most time 2 times a day, just in the morning and at night.
Good. And how long do you brush your teeth for?
Well, I don't really know how long I brush them for. I just go in there and I make sure I get all the way around as best I can. I have this arthritis in my hand, so it's a little bit hard.
So do you use electric toothbrush or a manual toothbrush for your arthritis?
Electric toothbrush, I don't have one of those.
You don't have one of those?
No.
So since you do have arthritis, I think it'd be a good idea if you could get an electric toothbrush. They come at Walmart. So electric toothbrushes you can get at Walmart. They can range anywhere from $5 to $180. It all depends on what type you get. But I really think that will help you get your teeth better since you do have a lot of recession and you are missing a lot of your teeth. I think electric toothbrush is a good way to go. Also with flossing, do you floss at all?
No, with my arthritis in my fingers, it's hard for me to bend and get them back there, so I don't floss too much.
Do you use one of those flossers like that on a handle?
No, I don't use one of those. I just didn't figure I needed to floss where I'm missing some teeth in here. I figured my toothbrush would get all the way around them.
Right. Well, I think it's very important for you still to floss even though you are missing teeth because you want to keep the teeth that you have, so flossing them can kind of get down in your gums where you do have a lot of recession and get some of that plaque out, okay? And we can show you what a flosser looks like, all right?
Yeah.
Alrighty, well, Ms. Richardson, this is what a flosser looks like. It's long handle, easy for you to grip on, and it has the floss right here at the end. So that way you can reach way in the back and get those teeth that you still have, and you get between them, okay?
Let me see that. Let's see if I can hold that. Well, yeah, this looks about like my regular toothbrush.
It's
I think
just
I
like
can
that.
probably do that.
Well, great. So, since you do have diabetes, do you notice anything in your mouth that's different? Like, do you have normal saliva flow or anything like that?
Well, come to think about it, I'm a person that likes to talk, and my mouth gets dry a whole lot, and I don't really know why.
So, I have this great clip here that's going to teach you a little bit about diabetes and kind of explain to you how it can affect your oral health, okay? So, I'm going to play this for you.
Oh, okay.
Of diabetes, you have an increased risk of developing periodontal disease. Diabetes contributes to periodontal disease in several ways. It can lower your body's ability to fight off infection and can slow healing. It also causes dry mouth and often results in high blood sugar levels. Diabetics often experience a decrease in the flow of saliva. This can lead to a condition called dry mouth or xerostomia. A lack of saliva allows plaque, the sticky film of food and bacteria, to build up easily on teeth. This accumulation of plaque is the main cause of periodontal disease.
So, what do you think about that video? Did you learn anything that you didn't know?
Well, I like that. Like you were telling me a minute ago, and that said I get dry mouth, and so that's from my diabetes.
Yep.
And that also causes periodontal disease.
So, where you have a lot of recession, your bacteria and plaque can get down into the deeper parts of your gums, and then that can eat away at your bone and cause periodontal disease. So, it's really important that we continue to floss and we continue to brush.
So, is that why my teeth is a little bit loose?
Yeah, if the bone's starting to go away, yes. So, ways we can help with the periodontal is the brushing and the flossing, and to help with the dry mouth, there is a saliva substitute called biotin. You can get it at Walmart just with like the electric toothbrush. I have some here to show you. It also has a fluoride substitute in it, so you can kind of keep your teeth a little more protected. It kind of puts a coat around them
So if I'm talking and my mouth gets real dry, I can whip out my biotin out of my purse and rinse my mouth out, and it'll make it feel better.
Well, you might want to go to the restroom and do a little swish in the restroom instead of yeah, basically that's all you need to do, and that can kind of help make your mouth a little more moist. Okay.
Okay, so just do that a couple times a day, or just whenever my mouth feels dry?
I would do it a few times a day, just to keep your mouth from getting dry. Because you don't want a dry mouth. So if you just do it maybe in the morning or after you eat during lunch, and then at night, it should help a little bit.
Oh, okay. Oh, I can do that.
You think you can do that?
Yeah.
Okay. Well, I think we went over a lot today, don't you think?
Yeah. Yes.
So I think before you go, I just want to remind you real fast about the electric toothbrush, about the flosser, and about the biotin. Okay? I think those will really, really help. Okay?
All right. I'll try my best.
Okay.
Thank you so
No
much.
problem. I'll walk you out. Okay?
All righty.